person-centered services. To address gaps and ensure individuals and families have access to the programs and services they need, the report also outlines actions in the following areas: adopting a proactive approach to improving mental health, bridging gaps in existing programs and services such as those addressing addictions, offering a collaborative model of care through an integrated person-centered approach to service delivery, offering culturally relevant treatments and services taking into consideration the individual's social context, and enhancing the knowledge and awareness of individuals, families, and healthcare and other service providers. And we look forward to making significant investments in the action plans and goals of these principles. And sometimes we're asked, well, how can we afford to invest in these things? Well, we can't afford to not invest in these things. We need to ensure that we're giving the support to those with addictions and those with mental health challenges. Again, improving their quality of life, improving the quality of life of their families, and improving and strengthening our economy. But also, in this case, we're very pleased to say that we are going to be able to make additional investments because of the bilateral agreement that we signed with the Trudeau government, allowing us to invest $230 million in additional funds into mental health and home care over the next 10 years. This will help. This will help us get to some of the roots of our healthcare system, making sure that we can have families be as healthy as possible, and at the end of the day, that is the goal of our healthcare system. So we're very keen, we're very excited to work with all of you to continue to make the right investments and to put the right policy programs in place. And we have no doubt that with the passion that we have from people like you that are in this crowd today that have contributed already and that will continue to contribute, and with funds that we'll be able to invest because of the bilateral with the Trudeau government, that we are going to be able to really improve the quality of life of those living with addictions and those living with mental health challenges. Now, although a lot of these announcements, they seem like the end, they're very much not the end. This is really the beginning. We have lots of work to do. You have a government that wants to work with you and make the right investments to improve the quality of life of those affected. And we want to ensure that we're going to measure our successes, and we're going to ensure that we continue to follow the evidence to make the best investments, to get the best bang for our buck, to improve the quality of life of those with addictions and mental health challenges.